Good morning, everyone. As most of us are not aware about that, we are in the process of taking accreditation from NABH accreditation, NABH body. So before that, we must understand what is NABH, what is accreditation, and what is quality in healthcare. And residents sitting behind, you are lucky that at this level you can be aware yourself about the quality in healthcare. In our time, we were not aware about what is quality. So let's start quality in healthcare and accreditation. So as we all know that health system is very dynamic. It's a matrix organization and it works in an environment with rapid social, economical and technical changes. There have been numerous examples of poor patient care, medical surgical negligence, inadequate resources with inefficient facility in the hospitals, lack of information and unwanted medical interventions. So, assuring quality in healthcare services become a mandate and receiving an accreditation is the only answer to the best quality in hospitals. It is a single most approach for improving the current standards, existing standards of the hospital. So now question comes, what is quality? So quality is doing the right things for the right people at the right time and doing these for the first time and every time. This is not that we have maintained a quality one time only, but we have to improve continuously in our healthcare services. So quality in healthcare is defined as everything the healthcare organization undertakes to fulfill the needs of its customer in case of hospital's patient, be in the patient, the payer who is paying for the healthcare services, the admitting doctor, the employer, or an internal customer within the organization. The father of quality, Donna Biden, defined quality in general terms as the ability to achieve desirable objects using legitimate means. What is accreditation? So accreditation is an external review of effectiveness or our existing quality system implemented with the standard, and we have to do the gap analysis and we have to find out how it is compliance with the national or international standards. So accreditation is a self-assessment and external peer assessment process used by the healthcare organization to accurately assess their level of performance in relation to established standards for the continuous improvement in healthcare services. Standards of accreditation are used on the principles of quality assurance, evidence-based practice, medical ethics, and prevention of medical error in while we are providing services to the patient. So we are in the process to get NABH and we are adding a 1 star of, we are in the process to add a 1 star in the Pratishta of AIIMS Hospital. So accreditations are multiple types. The JCI has also had Joint Commission International Accreditation. For public hospital, national quality assurance standards are there, but we are applying for NABH standards. So what is NABH standards? These are the standards for hospital authenticates that the NABH standards are in consonance with the global benchmark set by International Society of Quality for Healthcare Organization, and thus hospitals accredited by NABH will have international recognition. The objective of NABH is enhancing health system and promoting continuous quality improvement and patient safety. For this, we have quality assurance system and the quality control. So we have to plan our strategy, take out the multiple solution, and from these multiple solutions, we have to choose best one and act accordingly. This is a PDCA cycle. And after applicability of these solutions, we have to control our standards to improve our healthcare services. What are the driving force for getting accreditations? First is Consumer Protection Act. Everyone is aware, every patient is aware about the rules and regulation applicable on hospitals. Clinical Establishment Act, insurance companies, third-party insurance companies give insurance when hospital is accredited. Empanelment by the CGHS, ECHS, and other corporates, community awareness and their response towards our services. And nowadays, the medical tourism, health tourism is, for this, it is essential the hospital should be accredited by some external body. What are the advantages of getting accreditation? It is highly focused on the patient safety, patient care delivery by qualified staff only. Structure, outcome, or process ensuring consistency of the services. So every department should have their standard SOPs for delivering their services, which should be mentioned what is the scope of the service they are providing and what service they are not providing. It should also be mentioned. Transparency and credibility of the hospital services, including billing, etc. Quality of physical structure of the hospital labs, which should be safe for the hospital and the patients. And the reporting system. Every hospital service has a turnaround time. As per the standard, the hospital should maintain this TED. Ensures legal compliances with all the regulatory procedures. It raises community confidence. If hospital is accredited, patient has confidence that he will get a quality care in the hospital. And it provides opportunity to healthcare unit to set a benchmark with the best. What are the documents required during the accreditations? As we are in the process to formulate documents, first is quality manual or apex manual of the hospital, which is a combination of all the policies and procedure of each and every department. Minutes of the various committee. We have multiple committee. We have to mention the whenever we met and what was the action taken during the committee and what was the agenda. Medical records of the patient, various audits like medical and nursing audit, adverse event. It should be noted somewhere. It should be a lesson to prevent other events. So there they always see what are the adverse events you have maintained. Hospital associated infection, which is very important. Action taken report, if there is any sentinel event, any adverse event, what action has been taken. Is there any grievance report, is any complaint received from the employer against the harassment at workplace, what action has been taken, it should be noted. And the personal record of the staff to check the qualification of the staff working in the healthcare organization. Various committees are required, like quality cell to improve the quality in the hospitals, for audits, clinical, medical, internal audit, for the equipments, from the contaminations, to meet statutory requirement that prevention of sexual harassment at workplace. ICC committee should be there. The hospital safety, for the radiation, for the lab, and various safety parameters should be there, and there should be a committee to prevent any hazard any occupational hazard in the hospitals. Biomedical waste committee and the pharmacy and therapeutic committee to analyze any adverse drug event, narcotic policy, any drug adverse event should be noted. And this the work profile of this committee is to note down any adverse event related to the drugs. Code Blue committee, the infection control, hospital infection control committee. Blood transfusion, any adverse event related to the blood transfusion, to monitor this, that there should be one committee. Equipment management and the condemnation committee. How to go about for this accreditation process? First of all, we have to identify our gaps from our existing practices in relation to NABH standards. Then we have to start our documentation. Preparation of all the policies and procedures that comply with the NABH standard. This is mandate for each and every department. Get it approved by any higher authority, any core committee, and any higher authority, admin, or the legal team. Ensure that these NABH standards are implemented and integrated in the hospital routine functioning. Identify and implement training required. If we find that we are not comply with the NABH standard, then we have to give a training to our staff. Implement the standard in day-to-day practice and start capturing indicator for various departments. We have to mention our quality indicator while providing the service, whether it is ICU, whether it is OT or emergency. So we have to maintain what are our quality indicator, like the morbidity rate, mortality rate, bed sore rate, patient fall rate, etc. First of all, we have to do internal assessment. We have to self-evaluate our services. Then we submit application to NABH body. Then we'll call them. Then we are prepared. Then we'll call for the pre-assessment. So our journey is towards the establishing our quality system, getting accreditation to achieve our services with the excellence. We have certain important issues. First, quality management team. It is difficult to have a quality management team with the dedicated team members. They should be familiarized with the standards and guidebook to implement. Karna kya hai? What are the standards? Many times the clinicians are or the students are not aware what is the quality. So first of all, they should be familiarized with the standards of NABH. Then we have to make a quality manual for, and it is a combination of all the SOPs of each and every department. Various policy and procedures defining the scope of service, what they are providing, what is the procedure and what are the process in their department, and what are the quality indicators, which is very important. Identify certain events for monitoring, provide resources for quality improvement. कुछ भी हवा में नहीं होगा. We have to get man, machine and money to implement this quality system. Alter mindset. जैसा चल रहा है वैसा चलने देते हैं. ये नहीं हो पाएगा. So we have to alter our mindset that we are in the process to get a quality excellence. Identify gaps between what is expected and what exists. This is our procedure. This is our standard and we are practicing this. But NABH says that this as per their standard, this should be done like this. So we have to identify our gap and implement it. For this, we have to have vigorous training to each and every staff. And all the training should be uniform in each and every patient care area. We could encourage by providing incentive. Even a chai and samosa will work. Initially, preparation to provide extra resources, which is very important, and this is the responsibility of our higher authority. What are the constraints in our hospitals? First of all, manpower, log nahi hai, HR issues. Architecture of hospital. We have existing system. For example, we have bathrooms for the washrooms for the patient, but we don't have a grab bar. But NABH said we should have a grab bar. तोड़ना पड़ेगा, टाइल्स टूटेगा. So it is better कि पेशेंट की हड्डी टूटे हम टाइल्स तोड़ के दोबारा लगा दें उसको. Lack of time. Everyone is so busy. So there is no time to implement the quality system or to read the standards. Logistics, main constraint. Coordination with the multiple agency and multiple people working together. And the turnaround of trained manpower, which is very common because we have outsourced staff. We train them. वो शिफ्ट हो जाते हैं 3 महीने बाद. Again we have to train another staff, so which is a main constraint. What are the challenges we face? Attitudinal change. नहीं करना, नहीं समझना, किया था implement नहीं करना. Removing our blind spots, creating a holistic approach to the Medicare. Overcoming all these constraints is another challenge. Making benchmark for service provided. We have to set a benchmark for healthcare excellency and implementation of quality assurance program in the hospital. For this, we have to make a quality team. They must understand what are the quality indicators essential for every service. Quality consciousness at all levels will take time. It is not a overnight journey. It will take time, and we are making policy from since last 5 months. Sustenance and consistency of efforts will be required, and dedication of each and every member is required. Commitment on a consistent basis is required. High rates of turnover is there, so we have to give a repeated continual training to the staff. These may look difficult initially, but the first steps are never easy. Also, nothing is impossible. Impossible means I am possible. So we need our commitment to make a big beginning. To make it possible, we need a team total effort by all members. So we can understand this by our old story. हम सबने सुनी होगी कछुआ खरगोश की स्टोरी. I skip because सबको पता है कि खरगोश जीता था. The moral of the story was, slow and steady wins the race. This is the version of story that we have all grown up with. The story continues. Now the hare was disappointed at losing the race and he did some soul searching. He realized that he had lost race only because he had been overconfident, careless, and lax. If he had not taken things for granted, there is no way the tortoise could have been beaten him. So he decided, let's challenge the tortoise again. Now tortoise agreed for this deal. This time the hare went out all and ran without stopping from start finish. He won several miles. What is the moral of the story? Fast and consistent will always beat the slow and steady. It's good to be slow and steady, but it's better to be fast and reliable. But the story doesn't end here. The tortoise did some thinking this time and realized that there is no way he can beat the hare in race the way it currently formatted. So he thought, how can I win this race? He thought for a while and then challenged hare to another race, but at a slightly different route. Hare agreed. Okay, we'll do it. They started off in keeping with this self-made commitment to be consistently fast. The hare took off and ran at the speed until he came to Broad River. The finishing line was a couple of kilometers on the other side of the river. The hare sat there wondering what to do. In the meantime, the tortoise got along and got into the river, swam to the opposite bank, continued walking, and finished the race. What is the moral of the story? First, identify your core competency and then change the playing field to suit your core competency. Story still hasn't not finished. The hare and tortoise by this time had become pretty good friends and they did something thinking together. Both realized that the last race could have been run much better. So they decided do the last race again, but to run as a team this time. They started off and this time the hare carried the tortoise till the river bank. There the tortoise took over, the hare swam across the hare on his back. On the opposite bank, the hare again carried the tortoise and they reached the finishing line together. They both felt a great sense of satisfaction than they had felt earlier. The moral of the story. It's good to be individually brilliant and to have strong core competencies. But unless you are able to work in a team and harness each other's core competencies, you will always perform below par because there will always be a situation at which you will do poorly and someone else does well. There are more lessons to be learned from this story. That hare and tortoise never gave up after their failures. Hare decided to work harder and put it more efforts after his failure. The tortoise changed their strategy because he was already working as hard as he could. So this is important. Sometimes it is appropriate to change our strategy and try something different to get something different. When we stop competing against a rival and instead starting competing against the situation, we always perform better. So in the journey to get NABH accreditation,